Our next speaker is Dr. John Sweetenham, MD, FRCP, FACP. Is a practicing hematologist whose clinical research centers on lymphoma and the use of stem cell transplantation. He is internationally renowned for his research and has authored more than 200 original articles, chapters, and books in this particular field of study. Dr. Sweetenham has also been principal investigator on national and international trials regarding lymphoma. To top it off, he's been a former core committee member of the Eastern Cooperative Oncology Group Lymphoma Committee and their national principal investigator for studies in Hodgkin lymphoma. He currently serves as chairman of the Clinical Trials Committee of Leukemia and Lymphoma Research in the UK. Please welcome Dr. Sweetenham.
Thank you very much, everybody. Can you hear me? So first of all, I want to extend thanks to Philip for inviting me to be here again. It's a couple of years since I've been at this event. I couldn't make it last year, but it's really great to be back here again. And Philip had asked me if I would say a few things about advances in cancer treatment and maybe a little bit about screening. So I'm not really going to do that. I thought I'd go off in a slightly different direction, but I thought I'd start out by saying that I think the tendency at evenings like this is to, give a little talk about how research is improving outcomes and treatments are getting better and so on, and all of that is absolutely true. And I think that every year, I could come and give you that information, and every year it will be true because things continue to get better and better and better. But I think there are a couple of things that have happened this year which have really made me feel like the things that we do in terms of improving the lives of those affected by cancer have really changed in a very significant way. And one of them is a little bit more kind of local, and the other one is a bit more global. So I thought I'd spend a minute talking to you about that. Now, I have to start out with just a little bit of my own story, and I know you're all going to think, where's he going with this? And I'll try to sort of make it make sense towards the end. But as you will have heard, I've had a fairly kind of traditional life through my career as an oncologist, and as you might be able to tell, I started out in the UK, not West Texas. I often get confused, but it was actually in the UK. And I went through a pretty standard training, and I had a lab for a time. I did laboratory research, and I've done a lot of clinical research, and I've worked in a lot of places. And one of the places that I've worked in is Cleveland. I was at the Cleveland Clinic for a number of years. I became an Indians fan, so that hasn't worked out too well this week. But nevertheless, when I was in Cleveland, our two sons were, and still are, in fact, living in Denver, Colorado. And we used to go visit them quite a lot, and often, because they were teenagers and we had a lot of stuff to take to them, we would drive. And any of you who've driven the road from Cleveland, Ohio to Denver, Colorado, will know that it isn't the most scenic of routes that you can take across the United States. But one of the things it does have, especially as you go through Iowa and Nebraska, is a lot of silos. So everywhere you look, there are silos. And one of the things that really has come home to me, especially in this last year, is that for those of us who've been involved in taking care of patients and doing research into cancer, there have been too many silos, and we all live within our own little world, and for a long time, although we've done great work, it's been really difficult to kind of reach out beyond that and think about other possibilities for things that we might do. And I think, for me, that's changed a lot this year. Two things really have happened. The first of them is that I was lucky enough to become involved with an organization called the Utah Cancer Action Network. And you may not know it, but you are all members of the Utah Cancer Action Network because Needs Beyond Medicine is one of a number of voluntary organizations. And our task is to improve the lives of people affected by cancer and reduce the incidence and the impact of cancer in the state of Utah. And we have a lot of problems here. I think, for example, when you look at screening programs in the state, we have some of the lowest uptake of screening for diseases like breast cancer and colon cancer in the country. Our rate of HPV vaccination, which we know prevents cancer, is lower than almost anywhere else in the country. We have the highest rate of skin cancer, of melanoma, anywhere in the USA, because we have a wonderful climate. We're all outdoors the whole time. We get a lot of sun exposure. So we have, in the state of Utah, a lot of cancer challenges that we still have to face. And being part of the Utah Cancer Action Network over the last year or so, we've been involved in writing the Cancer Control Plan for the state of Utah. And it's really very broad in its scope because it includes everything from promoting research through promoting good food in schools, making sure that the kids get their exercise because that prevents cancer, make sure that they're educated about the sun, that they cover up so that it helps to prevent cancer. And in so many other ways, we try to improve the lives of people in the state and reduce their risk of cancer. And the way that we do that is by having a group of people in an organization who are most certainly not the kind of conventional groups. So it's anyone from patient advocacy groups to individuals who represent minority populations within the state, to people like myself who are involved in cancer care, to cancer educators. It's a really broad group of people who normally, quite honestly, had I not been a part of Utah Cancer Action Network, I never would have interacted with these people professionally at all. And what I've learned from that is how important and how powerful it is to get out of your own silo and interact with people who have different points of view and different perspectives, and how much that can help us and how powerful that can be as we try to reduce the impact of cancer. The second thing that happened this year is, as you know, I work up at Huntsman Cancer Institute. And earlier this year, you'll be aware that the president launched the Cancer Moonshot. Now, I hadn't realized, incidentally, until a few weeks ago that a lot of people don't even know what that means. One of the folks I work with at work, she's now about 30 years old, and we were talking a couple of weeks ago about a work-related subject, and she actually said to me, "Why is it called a moonshot?" And I think, obviously it's a generational thing that we hadn't really realized, but of course there are a lot of people out there who wouldn't necessarily have equated the cancer problem with going to the moon. But that apart, the president announced the moonshot, and we were fortunate enough in February to have the Vice President Biden, visit Huntsman Cancer Institute. And what's really given me, a great deal of kind of excitement about the future is that his whole concept is really around this thing of breaking down silos. We have so many brilliant, especially brilliant young people in the US who have skills which may be scientific, they may be around communication, they may be around information technology and handling data, they may be around communication, a huge wealth of expertise that really needs to be harnessed and put to work to solve the cancer problem. And I think that one of the things that the Vice President has done has stepped outside of these conventional silos, brought a lot of people together from many, many different kind of walks of life to really try to tackle this problem. And personally, I feel more excited and more hopeful about making real progress in the next 10 years than I have done in all the time that I've been in oncology, and during that time the progress has been very significant. So the goal of the Moonshot is to complete 10 years worth of cancer research in 5 years. And 10 years worth of improvements in cancer in 5 years. And I really think with what's happened so far that we're in a place where we could do that. One example, I'll give you just one example to close on, and it's kind of very important to us locally here. There's been a lot of controversy about screening. You'll have seen the controversy about prostate cancer screening. Just recently you might have seen Ben Stiller. There was a story about Ben Stiller that ran and his experiences. And so there is still this controversy about who needs to be screened and who doesn't need to be screened. But one thing that's for sure is that if you are at high risk of certain cancers because of your family history in particular, if you're known to be at high risk, you need to get screened. And one of the areas that we're particularly interested at Huntsman Cancer Institute is identifying those people who have a high inherited risk of cancer and making sure that they get screened. It's something that we're calling precision prevention, so that we focus the screening on those people for whom it matters the most. That's just one small example, but like I said, I think the real promise of the next 5 to 10 years is the fact that after a very long time, a lot of those ways that we've all traditionally thought about how to tackle the cancer problem and how to address the impact on us and our families and our communities, it's really changing. The silos are coming down, and I have absolutely no doubt at all that over the next 5 years, we're going to do 10 or even 15 years worth of advances in cancer impact. So I want to thank you for your attention. Thank you for putting up with my little story about traveling across Iowa. Enjoy the rest of the evening, and if I haven't really done a really bad job, hopefully Philip will ask me to come back again. We can do this again next year, so thank you so much.